A new national poll highlights the significant toll the pandemic is having on the mental health of teenagers. Elise Preston has more.
It's been a tough year for many teens like Dominique Parkey.
Just with being in quarantine a lot, it makes me feel alone.
The pandemic kept the 17-year-old at home and away from friends and teachers.
Once in a while, I'd see a neighbor outside. That was my only social life.
These changes in social interactions have perhaps hit teens the hardest during this pandemic, according to a new CS Mott Children's Hospital national poll. 75% of parents report this past year has had a negative impact on their teens' connections. 46% report signs of a new or worsening mental health condition.
Many teens have experienced disruption in their normal lives. That's coming from closed schools, from canceled activities, from an inability to hang out with friends and family. Just at an age where teens are biologically primed to want to have those experiences with their peers and to begin to separate from their family.
Dr. Gary Freed is co-director of the poll, which also found parents of teen girls were more likely to say their child had new or worsening symptoms of depression and anxiety. Researchers say parents can help teens cope. They recommend safe interactions such as spending time outside, social distancing, and mask wearing.
Many parents have also sought the help of either a primary care provider or mental health providers during this time. And the majority of parents who sought that help have found it to be beneficial for their teen.
Half of parents polled also loosened social media restrictions for their teens and say it helped. Dr. Freed recommends boundaries so that screen time doesn't interfere with physical activity and sleep. Elise Preston, CBS News, New York.
Good sleep hygiene is critical for teens, especially at a time like this. Experts recommend parents help kids create a good routine, whether they're doing virtual or in-person learning, with a regular sleep and wake time. New government data continues to reveal a rise in drug overdose deaths during the pandemic. The CDC released preliminary numbers from August 2019 to August 2020. They show a nearly 27% increase in deaths linked to drug overdose compared to the same period a year earlier. The report also shows drug overdose death rates are higher in urban areas in all but 5 states. If you're looking for ways to slow the spread of COVID, you may want to start by how you dry your hands in public restrooms. New research from the UK found high-speed air hand dryers spread more germs than paper towels. For the study, volunteers first sanitized their hands, dipped them in a viral solution, then used an air dryer or paper towels. Those who used air dryers had about 10 times more bacteria on their hands than the paper towel users. They also transferred more germs to their clothing and other surfaces.